Welcome, everybody. Thanks for attending the session here. We're love the Kelly HealthBiz webinar brings together a lot of folks to talk about healthcare and medicine, and really excited today to have Alen Voskanian, who is an alum of the Kelly Physician MBA program. He is also the Chief Operating Officer at Cedars-Sinai Medical Network. And Alen was part of were you in the first cohort or the second?
First cohort.
First cohort. So he started in 2013, finished in 2015. And as we were chatting about, if you were on earlier, we're celebrating our 10-year anniversary of that program here this fall. And so we're really excited for all of our healthcare programs. Recently, Alen has written a book that you'll see is also the title of his presentation, and that is Reclaiming the Joy of Medicine. I know that all aspects of healthcare workers, even well before COVID, there's a lot of burnout in healthcare right now. There's a lot of administration and a lot of challenges, and then obviously a global pandemic has just added to that. So, Alen, I will turn it over to you, and really appreciate you being here today and sharing your insights.
Yeah, thank you so much, Kyle. I'm always excited to come back and in any type of webinar or just in person. So I look forward to being back there next month. As Kyle mentioned, I'm a physician. Also, I have an MBA from Kelly. And I wanted to talk a little bit about burnout in healthcare and really focus on burnout of healthcare providers, but it really applies to everybody who's working in healthcare. It also the topic really is relevant to everyone in general in public. I think we all hear about burnout rates going up. So I think I will try to make it as relevant as to all of you, and I will ask for you to participate throughout this talk, and in the chat section, type in some of your comments about your own wellness and burnout. But as we know, especially since the pandemic, we have been talking more and more about burnout. And when I talk to some of my colleagues in healthcare, they say they feel so burnt out about all the talk about burnout, and they feel like nothing gets done. It's just that we're talking more about it. So why is there such a high rate of burnout in healthcare? I think the reason really comes down to our healthcare system, which is really, you hear the term healthcare system is broken. And that is the reason why there are a lot of physicians going into business schools and really trying to understand what is wrong with our healthcare system. That is not really working well for patients. It's not also working well for clinicians involved in it. Also, economically, we know that the cost of healthcare keeps going up. So I will address some of the root causes of kind of this broken healthcare system. But one thing I want to make very clear is that sometimes when we try to talk about burnout and addressing burnout, inadvertently, we start blaming people who are experiencing burnout. And I think when I talk to physician colleagues and nurses, sometimes there's this idea that, when people, their organizations talk about addressing burnout, they're really almost blaming the victims of this broken healthcare system by saying like, okay, well, now you need to do yoga, or you need to meditate, or you need to eat better. And I think that gives the impression that there's something wrong with our physicians or our nurses or people who are in healthcare. And the reason why they're burnt out, it's because it's their fault. And I want to be very clear that it's not anybody's anyone's fault who's experiencing burnout. It's just working in a broken healthcare system leads to burnout. So I'm going to share my screen here 1 second. Should be seeing my, oh, no. One more try here. Okay. So what is burnout? And this is the definition of burnout. It has three main components. It's emotional exhaustion. It's the sense of depersonalization and cynicism, and the feeling of inefficacy and inadequate personal achievement, feeling like we're not doing a good job, that we're not good at our job. So emotional exhaustion, I think, is very common. The sense of depersonalization is really not caring about the people that we work with or our patients in healthcare, and being very cynical. And you see this, I think we've seen this in different industries. I always think about airline industry when you getting on a plane, and right away you can see if the flight attendant is really burnout and has this sense of depersonalization versus they really care about you as a customer. And you can imagine that in healthcare, from all the different industries that we have, this connection and empathy is so important. And when our healthcare kind of workforce is burnt out and they are experiencing depersonalization and cynicism, it can have tragic effects on patients. Error rates go up, and patients feel like they're dealing with a clinician in healthcare who doesn't really care about their well-being. And again, I want to make sure that we do not blame the victims of burnout, which are the clinicians and people who work in healthcare. So how does burnout present? It's this sense of feeling sluggish, impaired concentration, feeling detached from our patients, from our colleagues, also from our families. When people are feeling burnt out, sometimes they really, it impacts them personally. Not having enough energy, poor job satisfaction, being more critical of not only their colleagues and patients, but also themselves. People who are experiencing burnout are more, just feel like they're not doing a good job. And then lack of control, and in worse situation, abusing alcohol or overeating and just not taking care of our well-being. Now, I know this is a very depressing slide, and probably a lot of you right now are listening and saying like, oh my God, I'm experiencing all of this. So yes, once in a while, I think depending on time of the year and if we're doing our budget or whatever, I think we experience some of this temporarily. But when we talk about burnout is when it's chronic and someone feels like they're stuck and there's just no hope. So when we talk about burnout, I have a couple of slides that's data driven. And obviously, Kyle, I needed to include some statistics and data to show that I was paying attention when I was in MBA. So
I very much appreciate it.
Yeah, exactly.
That's
so when we are,
slide.
Yeah. So when we look at the general population, the burnout rates as shown here in green line, it's been consistent, and this slide needs to be updated. But the point here I wanted to make is that physicians in general have a higher rate of burnout. That rate has been estimated to be about 50% based on more recent studies after the pandemic. So after, if you talk to two physicians, probably one of them will tell you that they have experienced burnout. So what are the top contributors or burnout in healthcare? And this is the part that I would like to ask you to type in the chat. What do you think is causing burnout in healthcare? I know we discussed some of it, but please type in, use the comment section and type in the chat. And I'll read them out as you type. So staff shortages. I think that's definitely, especially with the Great Resignation, we saw a lot of staff shortages when people who are working feel like, okay, now they have to do the job of 2 people because we are short-staffed. I think lack of control and autonomy, I know that is definitely a big issue, especially when we talk about, I think everybody wants to have control and autonomy in their job, but especially when we talk about physicians and nurses and people who are highly educated, there is this higher sense of needing autonomy and agency in our kind of life and in our work, and that is being taken away. Failure of leadership, not having good leaders, patients having higher acuity, higher demands, supply disruptions. We have definitely seen increased complaints from physicians and nurses that patients are more likely to get upset and angry at them. So that causes job stress. For example, patients don't like to wait in a crowded waiting room, and there's less tolerance for that. And that's kind of that just general change in our consumerism mindset that's healthcare perhaps has not really focused on in the past. But now patients are asking for that. They have higher expectations of customer service, consumerism, but it causes stress for the healthcare system that's broken and is not ready to provide that level of service. Unnecessary administrative requirements, peer issues with peers, peer-to-peer, prior authorizations, all of I think some of you who are physicians probably know that there's just so much paperwork that needs to be done. If you know you want to get a medicine approved, your patient needs a medicine, now you need to jump through a lot of different hoops to get that medicine approved. Over time, that wears off on people. Demand outside clinical work, the pandemic and lack of control, fear and sadness, inbox management, definitely. Number one issue that a lot of physicians and nurses bring up is the volume of in-basket messages they get on our new electronic platforms. So I think this is an unintended consequence. I think we all wanted to move towards electronic health records. It took us a while to get the doctors used to it, to get the patients used to it, but now patients are using it to get access to their patients because of our broken healthcare system. Access is horrible. I don't know about you, but when I call and want to schedule an appointment to see my doctor, often I need to wait weeks, if not months, to get in. So if I can't get in as a patient, what is the path of least resistance? It's sending an in-basket message. And now the doctors are spending significant amount of time after work in front of their computers addressing these issues on email, often feeling that they're not being compensated for that. So it's new volume of work that's has been added to a physician's workload. And then I'm reading having wait list. Yeah, that's exactly what I just mentioned, which is access. The demand is high. Mental health demand is very high. We don't have enough mental health clinicians, electronic health records. Perfect. So thank you so much for participating and sharing your thoughts. And, this is the survey results from a survey that was conducted by Medscape last year, and you pretty much captured all of the causes of burnout. Too many bureaucratic tasks, charting, paperwork, and in-basket work. That was number one root cause of burnout. Administrators, employers, colleagues, or staff, that was listed, and you mentioned that. Too many hours at work, the demand, as was mentioned. Control and autonomy, Kyle, you mentioned that, just not having enough control and autonomy. Pay was brought up at 28%, having insufficient compensation and salary. And this is really in the context of the in-basket work and all the work that happens after hours with electronic health records. EHR, electronic health records, increased time in front of the computer. Sometimes people call that desktop medicine. And the time that is spent after hours charting, sometimes people refer to that as pajama time. And you will hear that those are terms that some of the people are using in healthcare, who are really trying to quantify the amount of time physicians and nurses are spending in front of computers. Lack of respect from patients, that was brought up. Government regulations, obviously regulations are putting a lot of kind of restrictions, and it ends up causing lack of autonomy and control. This survey was done during the pandemic and after the pandemic, so the issues related to COVID-19 were mentioned. Stress from treating COVID patients were mentioned, and then there were other issues that were listed. I'm going to pause here to see if any of this is surprising to you. You can either unmute yourself or type it in the chat. I think you guys captured pretty much everything here, but anything that was a surprise? Think not a surprise. Yeah, and I think very impressive that pretty much you mentioned everything that that was listed here. So I think I'm going to talk a little bit about solutions, and as a physician who's also an administrator, and I've taken more and more of operational roles, especially I think the MBA really gave me the confidence and knowledge to go outside my area of expertise, which is really clinical, to focus on the business side and operations in healthcare system. So I have a couple of thoughts and suggestions about solutions. But before we dive into that, I wanted to bring a little bit of give you a little bit of a context and share a little bit about my story of why I went into healthcare. And then I'll bring it back to the solutions. So the reason why I went into healthcare was really, I'm going to share my screen here. It really comes down to my mom. When I was very young, I was about 8 years old. My mom was diagnosed with breast cancer. And I was seeing all the struggles that she was going through, and we were really worried that that we were going to lose her. And she had to have a surgery. And I vividly remember when the surgeon came out from the surgery room. My whole family was there, including me. And he shook everybody's hand, made eye contact, including me, sat down and told us that even though my mom's prognosis was uncertain, that he would be there and he would make sure that she was kept comfortable. And at that moment, I knew that I wanted to be exactly like him. I wanted to be a physician that was caring, was empathetic, and really cared about his patients and patients' families' well-being. So I started thinking about becoming a physician at that moment, but the odds were really against me. I was born in Iran as a Christian Armenian. And I think some of you know that there was a revolution in Iran. And after the revolution, it became very difficult for minorities to pursue kind of higher education. And there were just many issues. There was a war. And I ended up actually escaping from that country and immigrating to United States as a refugee. So I arrived in Los Angeles. I was 19 years old. I couldn't speak English and started working at Kmart and learning English, going to a community college, closing I was always in the closing shift, cleaning the kind of the bathrooms, and just, it was a horrible first job. I did not like it at all. But it also made me think that, oh my God, I don't want to be working at Kmart. I do really want to become a physician. But again, the odds were not in my favor. I couldn't speak English. I was in a new country. But I focused on education. And I did well in community college. I started tutoring. I was really good at math, so I started tutoring calculus. I was able to get into UC Berkeley, and all that was within my control at that time was studying and doing well in classes. I was like, okay, if I do that, if I get an A in every class, maybe I can get into medical school. And that strategy worked for me. I graduated from Berkeley and then graduated from medical school. And this is a picture of my mom and dad, who were very proud, who were able to come to my graduation. So you might say, okay, why are you telling us this? Why are you telling you this story? The reason why I'm telling you this story is that I went through a lot to become a physician. And many of the physicians also go through a lot to become a physician. And it's a tough journey. It requires many years of education and residency and challenging hours. So my story is just one story amongst many physicians. But at the end of that long journey, having 1 out of every 2 physicians feel burnt out is really a sad situation here in our healthcare system. And I experienced that myself after my first job. So I graduated, I went to UCLA, did my residency, and then I joined, I did a fellowship in HIV and AIDS. And this is in early 2000s. I was working in a nonprofit HIV clinic. Really initially felt like I was making an impact. My patients were very underserved. Some were unhoused. A lot of them had been abandoned by their families. It was very impactful work. I thought it would sustain me forever. I thought I was going to retire there. But about 2 years into that clinic, I started feeling symptoms of burnout. And at that time, we were not talking about burnout. We weren't using the term, but I realized that I had all of it. I was emotionally exhausted. I felt like I wasn't doing a good job. And just, I was very cynical about healthcare in general. And some of the pressures I was feeling was this pressure to see more patients in less time. And some of it is very financial driven. Our healthcare system, again, is broken. The costs are really high. And one of the ways that people think that they could make the finances work is by asking physicians to see patients faster. So I was, at some point, I think my schedule had 10 minutes for every patient. And my patients had AIDS, many social issues. Some of them did not even know where they were going to be able to sleep at night. They were coming in with what we were calling opportunistic infections at that time, which was like Kaposi sarcoma, this cancer of the skin, even TB. I was seeing a lot of just this really severe diseases. And I felt like 10 minutes was not enough for me to even address their medical issues, let alone their social issues. So I experienced burnout, and it changed my career trajectory. And I realized that I just could not work anymore. So I went to Craigslist and I started searching for positions in for physicians in healthcare. And there were just a couple of odd positions listed. I live in Los Angeles, so there were something about working in a for a casting company. There was an ad for a weight loss clinic that required a physician just to do a pre-participation physicals and read EKGs. And it seemed really simple. And I was like, okay, anything. I just need to do something and focus on my health and well-being. So I joined that weight loss clinic. And I think in retrospect, I didn't even realize it. It was a weight loss based on eating 5 cookies a day. It was called a cookie diet. And I was doing the physicals. And I know it sounds really just so unusual to look at Craigslist or work in a place like that after so many years of education. But I needed time to really reflect on what are my priorities and what are some of my goals, and how can I reclaim my own joy in healthcare. So that few months that I worked at that clinic allowed me the freedom to really focus on kind of my why. Why did I go into healthcare? And I realized that part of healthcare that I really loved was end of life palliative care. That's when I was seeing HIV patients at the end of life. And I felt like that time there was so much opportunity for physicians to make a difference. It brought me back to my original reason for going into healthcare, which was working with cancer patients at the end of life. So I did a pivot in career, ended up getting board certified in palliative care, but I also, and I loved it. I was seeing end-of-life patients. I decided that I was going to practice medicine the way I thought it was the right way of practicing medicine. I was happy. Once again, I had joy in practicing medicine. And then I looked around and I saw so many of my colleagues were still showing the same signs of burnout that I was experiencing. So decided that I would make another pivot and go into administration. And that's what brought me to Kelly, because I realized that, hey, there's like this whole new language around business of healthcare. And some of the root causes of burnout are really related to the business model of our healthcare system, which requires all these prior authorizations, which requires physicians to see more patients in less time. So that's how I got into MBA, and I love having a career that is still a little bit clinical. I still see patients, and then I spend time in administration with that passion to make things better for everybody, patients, because if physicians and clinicians are burnt out, patients don't get good care, and also for everybody involved in healthcare. So what is lesson learned? And I'm going to share my screen again here. What I learned in this process, and Kyle mentioned my book, Reclaiming the Joy of Medicine, is that we all need joy at work, and we need to find joy at work. And how do we do that? I think everybody, all of us know there's some things in our job that we love. And for some people might be teaching. Maybe half a day a week, people do some teaching and they love that. For some people, it's volunteering, or for some people, it's doing a specific type of work. So what I recommend people do is that if there's something that brings you joy at work, figure out a way to maximize that. And there are studies that have shown that if physicians spend about 15% of their time doing things that are meaningful to them, they are less likely to experience burnout. So now you might say, no, not like my job is horrible. There's nothing I love in my job. I think then I would recommend finding joy outside your work. So if there is you're in a profession that there is something you can do within your profession, or even not related to your profession outside your work, that brings you joy, do that. I know a lot of physicians that find extreme joy in volunteering, or in going on medical missions, or in teaching a weekend class, or sometimes doing things that brings them joy, going hiking or doing other things. So we all need to figure out a way to find the joy either at our work or outside work. But if truly that you're so burnt out that you can't find joy at work or outside work, that is really time to make a pivot in your career. And in the book, I really talk about how to do that. But I think now, shifting gears and bringing us back to some more data and solutions, I want to take a moment and ask you again to type in the chat, what do you think are some solutions for addressing burnout in healthcare? What do you think? We went over the problems. You kind of were able to capture all of it. But what have you found to be helpful, or what do you think would be helpful in addressing burnout in healthcare? So please type them in the chat. So mental health resources for staff. That's a really good point. I think a lot of organizations have, through their human resources, they've developed a lot of programs for healthcare and mental health. Unfortunately, a lot of clinicians are very hesitant to take advantage of such programs. And I think that is really one of the causes of this problem, is that a lot of licensed clinicians, physicians, nurses worry that if they access mental health, especially through their insurance, that their license might be impacted negatively. So there is a movement from a lot of clinicians to make it less taboo and more normal to seek mental health when needed. I think I see here that comments about culture, allowing a culture that's allows for downtime. I think a lot of people in healthcare are very goal-oriented, and there's this term, I think in medical school, and I heard in law school, people use this term called gunner. I don't know if you guys have heard. Yep, somebody posted there. It's this thing that, like, you're first like super competitive, and then second is like, if you get an A, you're not happy, you want to get an A+. And which reminds me of my childhood, but I'm trying not to replicate that with my own kids. But I think we are very goal-oriented. I think it's almost a condition for being successful in healthcare. The schools are so competitive. Getting into medical school is so competitive. Then getting into residency is competitive. So I think there's this sense of always comparing ourselves to other people. And I heard, I think this saying that says comparison is thief of joy. That's really true. Sometimes maybe that helps us when we are younger or early in our career. But as we advance, at some point, we need to say, okay, enough is enough, because that comparison continues. It's comparison about, am I making the same amount of salary? Do I have the right cars? Or do I Do my kids go to the best schools? So I think at some point that being that gunner, that super competitive person could end up leading to burnout. I want to read the comments and be cognizant of time. Better work balance, decreasing administrative tasks, exactly. Setting boundaries that are institutional, not personal. Do not page people after hours. Do not kind of manage the in-basket. Having strategies for healthy coping. Having space away from work to disengage. Yes, taking vacation, taking time off with our family. And fundamental reorganization of healthcare. So yeah, I think broken healthcare system needs to be changed. And that's why all of you involved in management and getting your advanced degrees in business, especially if you're interested in healthcare, we need all of you, because we need to fundamentally make changes in our healthcare system. Moving more away from desktop to spend more time in patient's room. Definitely, I know that is true for me. Building personal connections at work, formal analysis and improvements. Yes, we could use some of what we've learned in operations. I think some of you might be very familiar with like A3 thinking or kind of root cause analysis. Like this problem needs a like thorough root cause analysis. Okay, so I think you guys did such a great job posting it, and hopefully we can share the comments because there's a lot there that is right on target. But I want to share some of the some of the recommendations that are coming from Stanford model of professional fulfillment. There's a lot of work being done at Stanford focused on well-being. Some of it is on physicians, but it really applies to everybody. And it really organizes the work, everything that you put in the comment, in three main buckets. So first one is really focused on culture of wellness. I think you guys someone had put in culture. The second one is really focused on efficiency of practice. And then the third one is personal resilience. So I think, as I mentioned early, burnout is not anyone's fault when they're experiencing burnout. It's kind of a side effect. It's almost, think of it as an occupational hazard. If you work in healthcare, it's just can lead to burnout. So we need to really focus on the culture and efficiency of practice. Those are the root causes, but we all know that those are not going to be fixed overnight. That's going to take years to fix our healthcare system. So while we're waiting to fix our healthcare system, we need to focus on some of these other strategies for self-care and self-compassion and finding our meaning at work and work and life integration. I think in the interest of time, we have 5 minutes. I just want to wrap it up here quickly. So I think some of the things that I've seen be effective is reducing and eliminating administrative burden and bureaucracy. This is really focused, I think those of you who've taken Lean or Six Sigma classes, reducing waste in healthcare. Or another way of putting it is reducing the pebbles in your shoe. Those are all the little, and like sometimes we say like stupid stuff at work. In healthcare, there's so much of it that is unnecessary. So really focusing on removing those and then transforming organizational structure to allow for autonomy and agency. I think Kyle mentioned that that's one of the big problems, losing that autonomy and agency. And yes, it can be a wild, wild west and everybody can do whatever they want, but there needs to be some kind of guardrails and then autonomy and agency within those guardrails. And then leadership role is extremely important. We need leaders in healthcare who have experience with the business side, but also they have kind of good skill set in the head and the heart. And what are some of those skill sets that are the softer side of leadership, ability to recognize when job is well done, inspiring the team, having career development conversations, providing support and resources, being transparent, and being inclusive. So with that, I would like to wrap it up, and this is the link to the book. We'll share some of the slides. Feel free to reach out to me on LinkedIn. I'm pretty active on LinkedIn. If you type in my name, it's very unusual, so I think you'll find me easily. I try to post there. Reach out to me if you have other thoughts or questions. But I'm going to pause here, Kyle, and hand it back to you if there's time for any questions.
Alen, this is phenomenal. Really appreciate this, and I think it. I'm here in part because I do some work in healthcare with you all and with our students, but it also, so much of this resonated with me in terms of academia and other industries. I think this is really broadly applicable. So really appreciate your time and sharing. We want to sort of keep it. If folks have questions, I think we could type them in a little bit. I do want to turn it over to Janelle. She's going to talk a little bit about some of our programs and folks who might different ways to get involved here at Kelly. And so Janelle, I will turn it over to you. And she's got good news here.
Yes. Hello, everyone. Thanks for joining us this afternoon. As promised, we are going to give away a copy of Dr. Voskanian's book and Nazarene Zumba Fitness. You have won a copy of his book. So if you would like to email me your contact and mailing information, I can get that book out to you. So congratulations on that. You will be receiving an email from me. All of you guys will be receiving an email from me with the slides, and then of course a link to the recording on our YouTube channel with our other webinars that we have available. And then again, as Kyle said, these are our Kelly Healthcare programs. And so we have 5 programs that deal in healthcare. First, our graduate certificate in medical management program, which we call a mini MBA. We have a partnership with the IU School of Medicine and the IU School of Dentistry with their dual degree programs. And then, of course, we have the evening MBA, which is a part-time MBA that we have on campus once a week, and then our physician MBA for practicing MDs and DOs. So if you want any questions, or if you have any questions or want any information on any of these programs, feel free to contact me at the information there. Thank you all for joining us, including Doctor. Thank you for joining us today. And yeah, we hope you have a great afternoon.
Thank you so much. Thanks, everyone. Appreciate it.
Thank you. Bye.